of housekeeping rules. Please, we ask that you keep your computers muted, please. I ask that you keep the computers muted. Also, if you have any questions, we ask that you put your questions in the chat room, and we will definitely have your questions answered. And we also ask
not complete their clinicals to come in and help us from a vaccine perspective. We have since then triumphed. We've had over 50,000 patients discharged safely. We persevere, and they can't see. How are they going to use a glucometer? These are the things that we're starting to teach our nurses to think critically at a higher level, not just focusing on assessments and medications, but to think about social determinants of health at the bedside, to make sure that every nurse leader is thinking about what will happen to my patient in their social settings. Every nurse must do this. Every nurse must do this for their patients. Every nurse should do this for their family members. It's this critically important for us to make a difference on health disparities. We are uniquely poised to take into account the distinctive and diverse cultures, right? So I'm from Haiti. My parents are from Haiti. I was born in New York, Nigeria, whether it's Ghana, Uganda, anywhere we are, to make sure that we're making a difference in the care and the lives of our patients that are in our communities, right? And so in summary, I shared a lot, right? But I want to remind you that nurses, we are integral to designing, I am creating new health.
Whoa, whoa, whoa. That was awesome. Awesome, awesome, awesome. My God, I am truly blown away. I'm lost for words, blown away. Great nurses. My God, so much comments here. Thank you, Dr. Sianes. Oh my God, great information. Excellent presentation. You really took it to the next level. You sure did. Wonderful speech indeed. I'm so proud to be a nurse. Really proud to be an African-American nurse. I'm inspired by your presentation. Thank you. Impressive, impactful, informative. Thank you. Whoa, whoa, whoa. Some of your nurses are even here from the Health and Hospital corporations. Proud to be working in a system with such a nurse leader. You're truly a great leader. Nana, we scored big on this one. What a great keynote speaker. Excellent presentations, great points to follow. Thank you. Thank you so, so much. You should be sensitive to the patients. We have to learn to be sensitive, not just taking care of what happens when they go home. What do we do when they go home? That's what we should be looking at. We should think about all these things. And Dr. Natalia, Natalia really nailed it, and they had excellent keynote speech. Thank you, wonderful. My God, it just keeps coming in. I'm so impressed. It's a powerful information. Oh my God, great information. So we truly, truly thank you for this awesome presentation. We could not have asked for anything better. Dr. Natalia, thank you so much for honoring us. Great nurses, let's just give her a hand for honoring us, for coming today. Thank you so much. Thank you, thank you. And you did keep to time, which is a great thing. So you kept to time, which is awesome. Sometimes
on this report, and I'm going to hand this over to Dr. Allison Squares, who would lead this section for us. Welcome, Dr. Allison.
Thank you, Dr. Sanda. As always, it's my honor to be here presenting with NANNA. I had such a good time the last time I worked with you all that I could not resist coming back to at the invitation to speak. So my role today is to talk about the National Academy of Medicine, formerly known as the Institute of Medicine, what it does and how the consensus report study process happens. And most people are usually not aware of what the National Academy of Medicine does or how it does it. So the important thing, so giving insight into this process helps lend some credibility to the strength and the rigor behind the consensus study. study. So the National Academy of Medicine was actually started, and the whole consensus study process is meant to be entirely confidential so that people can speak freely in the meetings and express their views as they deem appropriate to building the content and coming up with the design, with the content of the report itself. And normally, and anyone can actually commission a National Academy of Medicine report. So this is where Robert Wood Johnson came in to fund the National Academy of Medicine, the Future of Nursing report. And it was unusual actually to have
equity. And if you look at what the keynote speaker had said, the data she has provided about where we are when it comes to minorities, and see the impact of pandemic on minorities, you can see that now NANNA is prepared because we have NANNA members who now have the education. But guess what? You now have to use the education to effect the change in the community. So if you're looking at the key messages for 2020 to 2030, so what are those key messages from 2020 to 2030? What is it that we should be doing? So in NANNA, we're also saying we need to look at these key messages so we can key in and so we can be effective in our community. If you look at number one key message in this report that had just been released, is that policymakers need to permanently lift artificial regulatory and practice barriers that keep nurses from practicing to the top of their education and training. If you systemic biases and racial inequities that persist in healthcare, very critical that our workforce should reflect the population we serve. So if you look at the healthcare leaders in New York, how many of them are minorities? It has a lot to provide for us, as we move this organization forward. And also she's going to address us on charting a path to achieve health equity and what NANNA can do. Thank you so much for having me. And thank you, Dr. McDaniel, for accepting our invitation to continue.
Oh my goodness, what a powerful message from you, Dr. Grace, and from our keynote speaker. I am so excited here. This is wonderful, fantastic. Thank you, National Association of Nigerian Nurses in North America, for inviting me, for existing, for being here. I am just so excited. And thank you so much for inviting me to your virtual scientific conference. It is a pleasure, and it's a pleasure to be before these great nurses and discussing the topic that I love most, which is moving from thoughts and ideas and theories about equity to health equity.
And I promise you next year, Pennsylvania will make it up to us. We will eat double, because now we are eating this by ourselves. So next year, I'm sure Pennsylvania will definitely give us a good treat. So Pennsylvania, be ready for us next year, because now this year we are eating on our own. So next year, Pennsylvania, I'm sure you are up to the task. But there's one thing I ask of everybody: please do not eat pounded yam for this lunchtime, because I want you to come back, alert for the next session, because I don't want anybody sleepy after eating pounded yam. All right, so enjoy your lunch, and we'll reconvene back at 2 p.m. Thank you. Thank you, everybody.
1 in 10 or less, that is a problem. So if you go to the next slide, you will see that the primary reason for immigration is education, and I already mentioned that. At this point, I'm going to ask Dr. Olare to continue to expand on the factor analysis of the constructs that we found. Dr. Olare.
Wow. Thank you so much, Dr. Adeoshi Fogun, and the organizers of this awesome conference. I feel kind of odd being a social worker in the midst of nurses, But we know that the situations that we're talking about is a multidisciplinary problem. And many of these issues, like we already know, that needs to have everybody's hands on deck. So while I might be a little odd out, but when it comes to the situation that we're dealing with, we all have, that passion. We have, that man for anyone who wants to be understood in the context of their cultural experience. I would also encourage us to go into the registry of the American Psychologists Association. There are Nigerian psychologists. There are Nigerian licensed clinical social workers that are available, but we just have to step out. Right now there is a lot of information, online, and you just have to do your research and look around. But it just takes getting over that, And once again, I'm so impressed with NANNA. This is amazing. I don't know if you have a registry, okay, where you have list of mental health providers that that is where the collaboration comes in, multidisciplinary approach, that someone can come to NANNA website.
No.
Recording.
The water is boiling.
Mama, what day is it today?
Tony's birthday.
Yes. I was wondering if you forgot. So, I talked to Vera. She said it's okay for us to come over for, to make it a surprise for him.
And they're working today?
Mama, they're working, but that's the point of the surprise. I have a key. So, we're going to go there and we prepare everything before they come back.
It's okay. It's okay. It's okay.
Yeah. Okay, please, can you put it on?
You didn't see her back here. Mama was sick. Mama just got here sick. What? And then Mama was here? Yeah, she just came back from work and she took Mama to the hospital.
No.
You even asked her a question, how did this happen?
No.
You just, oh my goodness, I've been telling you about holding your hand. How long this was telling you about holding your hand?
The information that you guys have shared has struck home, and this is something that is so important, information that needs to be shared. As part of the education community, I'm taking away information that's going to be useful for me as I talk to people, especially about domestic violence, including that and making sure that's part of our curriculum when we're talking to future nurses. Also making sure that the information that's shared about diversity and inclusion is also included in all of that. I just love being part of this organization. I miss you guys. The last time we saw each other was in 2019 in person. Looking forward to getting back into that. You guys are near and dear to us. Look forward to working with you in the future.
Thank you. Thank you so much. Thank you for joining us. You have been in the program from the beginning. I noticed. Thank you so much for staying with us throughout the whole program. We appreciate you. And Mr. Yinka from Grand Canyon is not here, but we really appreciate them. They've been partners with NANNA for years. Nurses, scientific. Lord bless you all. Bye-bye.
Today's virtual event is powered by Mobile Studios Production. For all your virtual event needs, please contact my friends at Mobile Studios via phone number 1-631-569-6092 for a free consultation.